Hi, my name is Andres Padilla, and today we will be doing the hamstring range of motion assessment, which is the active straight leg raise. The purpose of this test is to demonstrate hamstring flexibility, and the muscles involved are the biceps femoris, which attaches to the fibula. To perform this test, the patient must lay in supine position with the opposite leg of the one being tested remaining flat and secure on the ground. Then the patient will raise their leg by performing hip flexion while keeping their knee fully extended until there is resistance or there is any pelvic movement or movement on the opposite leg being tested, like so. After performing the test with both legs, measure the hip flexion angle with a goniometer. Some things to look for during this test is any pelvic movement while lifting the leg you are testing, any knee flexion or movement of the contralateral leg, such as external rotation, possibly. This would result in an invalid test. Any compensation will help you flex the hip further, which would then result in false data for this test. Some qualitative measures for this exam are, for example, when you have your leg fully flexed, raised in the air, you draw a vertical line from your heel down to your thigh. If the line comes down straight above the hip, that would be considered qualitative measure 1. Anything towards the middle of the thigh would be qualitative measure 2, and anything below the lower third of the thigh or your knee would be considered qualitative measure 3. For the qualitative measures, getting a score of 1 would mean you have good hamstring flexibility, a score of 2 would be moderate hamstring flexibility, and a score of 3 would be poor hamstring flexibility. For some quantitative measures for this exam, a score of 90 degrees to 70 degrees of hip flexion would be considered good. Anything below 70 degrees would be considered poor, or more than 10 degrees of asymmetry of hip flexion angle of the legs would be considered increased risk of injury as well. If this test results in a positive, this could indicate that you have tight hamstrings. Some limitations of having tight hamstrings could be limited strides while walking or running, or increased risk of strain while playing sports that include walking and running, such as track and field and soccer. This could hinder your performance in those aspects of the sport as well.